Oh. Bad shark bites, gnarly dislocations, and holy splinter, Batman. Wow, wow, wow. Today, we're reacting to all of the healing animations from some of your favorite video games like Far Cry, GTA, and more. How accurate are they? We're about to find out. Let's dive right in. Oh! We have a shark bite to your forearm, big sharp teeth that are going to embed into the tissue, causing puncture wound, as well as like a ripping injury. We do worry about fractures to the bones. In the emergency department, we'll actually get x-rays. And then what's really interesting, when you have puncture wounds that are pretty big, we don't necessarily close them all the way up because we know they're inoculating bacteria into the tissue. There's a high chance that it'll become infected. I love me some Far Cry. I would just snap it back in place, no problem. Sometimes it's actually pretty easy to put either a fractured bone back in alignment or a dislocated joint back into place. Just need to have muscle relaxation. Sometimes somebody is super relaxed and is able to get back in with some pain medicine, versus if you're not really relaxed, we'll probably do conscious sedation. Oh, thumb dislocation. Nice. Thumb or finger dislocations are typically one of the easier ones to put back because you can actually anesthetize just the finger. So we'll do a nerve block just to the digit. It's called the digital nerve block. Nice little bandage here. We got like classic bandage. I know in the game Far Cry, some of the bandages aren't just wraps and bandages. They actually have like medication in them. But in general, anytime you have open wounds, it needs to be covered. It would be beneficial if any open wound gets topical antibiotic ointment on it. The ointment also provides a barrier preventing things from getting in, as well as keeping it covered with a wound dressing. Oh, nice. We got an auto injector. We have a couple auto injectors that we use at the hospital. Everybody knows the EpiPen, which go right through the clothes. The point of pushing on it is it auto injects in and it gives you that medication that's in there. Sometimes there are Narcan pens. Okay, so naloxone in case somebody overdoses. Ooh. Puncture wound through the hand. What do I always say? Don't pull it out. But in the hand, as long as it's really not in your wrist radial artery or your ulnar artery, you're probably going to be okay, and you have the ability to put enough pressure on it to get the bleeding to stop. That is the increased risk. So the risk is worsening bleeding and potentially causing more trauma or damage as you pull it out. But again, somebody's going to need to pull it out anyway eventually. So if you're found yourself in a situation where it's inhibiting what you're doing to get to safety, then there's always exceptions to the rule. Oh, he bit his own forearm to get what appears to be foreign body, maybe a bullet out of the arm. It is a misnomer that we take bullets out. Now, if the bullet is that superficial that you can pull it out with, say, like your teeth, then we will take it out right then and there, easy. But if it's deep embedded into the tissue, it stays. The only time we really get rid of it is if it's in a joint near your spinal cord or in your brain. The only type of green elixir that we have in the emergency department is actually liquid cocaine. Yes. It's not something that we actually ingest. We use that specifically in the emergency department for nasal bleeds. It causes vasoconstriction, so we could put it on a cotton swab and put it in the nose. We don't like too much of it because cocaine could cause tachycardia, so we don't want somebody's heart rate going up or messing with their blood pressure. Oh, cool. We got the prosthesis that is metallic. We're not there yet where we have the prosthesis that can function on its own per se, but we're getting close. As you see, a lot of robotics happening, autonomously doing things on their own. But when it comes to the human body, there needs to be a connection of that arm to the brain to have appropriate function. Oh. I wish I had this type of miraculously healing fluid that I could just pour over my patients' bodies and heal them. So we don't have this. Typically, when we have a bad wound that we want it to heal, we clean it out really well, and then your body has to heal. We're just doing things to hasten along the process or prevent it from getting worse, but our body's mechanism is to prevent infection in general, so your body will heal yourself. Oh, nice. And again, my favorite, either finger dislocation or fracture. Fractures also need to be put in a line. Sometimes if they're so bad, orthopedic surgeon or a hand surgeon will actually put a pin that looks just like a sewing needle, and they'll put it directly into the bone to make it align. But a lot of times these will be coming out of the skin. So you got to be careful and make sure you get them removed in the appropriate time. Removing an arrow out of your arm, there's the potential of it having the barb and getting stuck. If that were to come into the emergency department, which really doesn't happen, we'd have to be careful as we try to reverse that out. Sometimes it's easier to push it all the way through the tissue. We'll have people come in who have gotten tased with the projectile tasers that have barbs, and we have to take those out. We need to pull that out. Sometimes we rip it out. Sometimes we're able to use an 11 blade and cut it. Oh, the noise. Most of the time we don't necessarily hear the crunch when we put it back in, but we do feel it. Usually it's just the ER doctor and maybe the tech that can feel it because we're holding the limb. That is more of a sound of not a joint going back in, but realigning broken bones. The way that it is twisted and bent looks more like a broken bone than it does a dislocation. The ankle is turned in quite a lot. Ankles could be pretty difficult to put in because there's so much muscle attachment and tendon that it's keeping it out. Those will use conscious sedation for, so somebody can not be in agony and relax. Just depends on the direction in which you actually have to pull and turn it. Making sure good pulses after and sensation. Oh, come on. Come on. You don't need to just stab yourself in the leg to remove a foreign body. Most of the time, foreign bodies will make themselves out of your body. Your body will reject it. If you can easily grab it, fine, take it out. But you're in the middle of a battle, you're just like stabbing yourself in the leg. You're gonna cause more trauma. You have to be careful. People always want us to get the foreign body out, but not realizing that we can actually cause significantly more damage to the tissue. Ooh, a little emergency kit. First aid kit, I have one at the house if you guys want to see. I used it on the show with Coyote Peterson on Brave Wilderness if you guys want to check that out. I do keep emergency kits around, even in my own car. I have like tourniquets, just you never know. Bandages to the arm and different medications. Just depends what you're using it for, but these are healing. Ooh. That didn't look healthy. That looked more like a burn. Ooh, burn! Second or third degree burns to the hand, they immediately need to go to a burn center to be evaluated because hands, feet, nose, ears, genitals, and anything circumferential, or depending on your age, depending on the percentage of body surface that's been burned, they need to go to a burn center. Oh, a little canister to inhale. That is super cool. It says gas on it. That is very generic. Could be oxygen. Could be helium. Those are the two gases that we use often in the emergency department. Oh, you're on fire. Stop, drop, and roll. Fire! Or smother yourself with like your blanket or pat this out. You do not want your clothes to catch on fire. It's going to make everything worse. Once a burn sets in, the burn has happened. Sometimes people will put antibiotic ointment or Silvadene on an unopened wound. It really won't help. You need to just keep the tissue moisturized in those circumstances. Oh, wow. That was pretty good graphics. Nice. Just pulling through a leather glove and through the soft tissue, the pad of the finger, which can bleed a lot and can actually cause an infection leading to a felon. Treatment of it is sometimes actually putting a device through and through, so it allows it to drain out because there are a lot of septated areas to the pad of the finger. But you got a glove on, it's gross. We don't typically cauterize things too often in the emergency department. We like to do direct pressure and then suture things versus burning them. There are times we might use a burning technique. In the operating room, sometimes they will use what's called a Bowie knife, and it actually sends a little like electrical current through it so you can cauterize something. I love that there are so many games that have bandages and healing. If the games are doing it, maybe do it in real life and bandage up those wounds and make sure they're not just dripping everywhere. There's so many times that somebody comes to the emergency department that have wounds that are open and they don't realize that they need to cover it and they're gonna get worse. I took somebody's shoe off the other day and it just smelled of funk. The bacteria was just producing such a bad odor. I love the drama of popping the lid. You're gonna eat all the pills at once or you have to refill it, but these are capsules. That way there's the powder on the inside. Usually breaks down pretty easily in the stomach. This could be pain pills. This could be antibiotics. This could be something for anxiety. It could be something for depression. It could be a supplement. It could be one of my supplements, Level Up by Life Happens. It's got a lot of good things to keep you focused and give you a little boost of energy. So if you're actually interested in it, definitely check out Life Happens. It's my company, lifehappens.com or on Amazon. E. coli. We have snacks here. We got the Ego Chaser, E. coli. As long as it's E. coli, not E. coli. E. coli is a bad bacteria that we have naturally in our body, but if it ends up in the wrong spot, it causes issues. It's like the #1 reason why somebody has a urinary tract infection. Not a big fan of sodas. There's a lot of sugar in there.
Sugar.
Deadpool. There's a Deadpool game? Nice. So Deadpool and his sweet healing powers. I've asked before if Deadpool's head was destroyed, that if he could re-heal, and everybody in the comments told me that if any piece is around, it will re-heal. Oh, and of course we got the healing powers of Wolverine. Look at this. Just cleaning up, healing up. Unless he's got that crazy weird bug on the heart that wasn't allowing him to fix himself. But very cool. And that's just why he has the metal in the body, right? He's able to heal himself. I wish I had that healing power. That'd be pretty cool, right? Oh. Oh, no. A wasted med kit. There are times when, you know, in medicine, you're throwing the kitchen sink at somebody. Meaning end of life care, you're doing everything humanly possible. And yes, you take a step back and you can be like, oh, you're wasting blah, 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 blah. It's like, no, I don't care. I'm going to do everything I can possibly to help this individual in this moment. And we will throw the kitchen sink at them because that's what they would want us to do. Also, check out my limited edition Dr. ER apparel, available now for a short time only. Once it's gone, it's gone. So grab yours before it's too late at shopdrer.com. That was a lot. That was a lot of healing animations in a lot of games. If there's a game we didn't get to or I didn't look at, please let me know in the comments. But if you enjoyed this, definitely check out this playlist right here, binge watch everything, and do me a favor, subscribe, turn on your bell notifications, and hit that like button for me. Thank you so much for watching, and stay healthy, my friends.